Hi there, thank you for joining us for our third week of physical therapy talks. Today we are going to be speaking with Dr. Stacye Seay. She's one of our physical therapists here at Hampton Roads Orthopedics. And as a reminder, in case anyone forgot, October is National Physical Therapy Month, so let's get right into the interview with Dr. Seay. Hello.
Hi.
Let me just put you on the camera here. All right. So thank you so much for joining us today. It's Friday, thank God. So I'm just going to jump right into it with our questions. So tell us a little bit about yourself. What are your hobbies, things that you like to do?
Sure. Well, I'm from Roanoke, Virginia, and I made my way across the state going to school, which landed me in this area. So I've been in Hampton Roads for the past 18 years, and I currently live in Gloucester with my husband and 6-year-old son. And outside of work, he's keeping us busy with his sporting activities. He's in soccer right now. We finished T-ball a couple months ago, and he's also races a go-kart out at Langley Speedway throughout the year. So again, when we're not at work, that's kind of what we're doing outside of work.
That's so cool that you're from Roanoke, because I went to school at Radford,
Okay.
so
Yep.
That's super close. Can you tell us more about where you went to college to become a physical therapist? Did you know that that was what you wanted to do?
Sure. I did my undergrad, I got my undergrad degree in biology from UVA back in 2003. So for anybody keeping track, we have 2 Wahoos in the clinic. And then straight from UVA, I came down to ODU for PT school and got my Doctor of Physical Therapy degree from there in 2006.
Awesome. Did you know that physical therapy was what you wanted to go into, or how did you find that career path?
So I played several sports in high school, throughout high school, soccer, basketball, and volleyball, and through that I dealt with injuries of my own. Nothing major, nothing that required surgery, but we had a sports medicine facility at our high school, so spending time in there doing kind of my own rehab, having my own experience with that sparked my interest to then pursue physical therapy once I got to UVA, and then I was taking the courses I knew I needed to take to then apply to PT school at the appropriate time.
It's so cool because you and Dr. Carlson and Dr. Forrest, y'all all played sports, and from there decided that you wanted to do physical therapy from sustaining injuries and probably interacting with other PT people. So it's kind of cool. Did you do any sports in college as well? Or
I did not play sports in college. I thought about playing soccer because soccer was my, I guess, kind of main sport of the 3 that I did. I also did travel soccer growing up for the Roanoke Stars, and probably could have had the opportunity, depending on where I had chosen to go to school, to play soccer, but I decided not to go down that path.
Awesome. And as far as PT here at Hrosm goes, do you have any specialties, or are there any specific patients that you like to rehab in your line of work here?
Yeah, we treat just about every diagnosis or body part that comes in the door. There's, and we're going to get our fair share of total joint replacements, just given, the practice setting that we are in here. But sometimes, it's nice or a fun challenge to have a patient that comes in with, say, back pain and, non-specific back pain or in pain that's also in their leg, and then trying to determine or do a little more detective work if there's a connection there between the back and the leg. Is the leg pain coming from the back? Are these 2 separate issues that we're dealing with? I have training in Mckinsey Therapy, which is both an assessment and treatment tool designed to target patients that have pain originating from their spine. So that can be an effective approach, and especially those that also have radicular pain, going down their arm or their leg.
That's cool. And how long have you worked here for Hrosm?
I've worked here for 3 years. I've been a therapist for 15, but been at this facility for the past 3 years.
Awesome. And our final question for the day is, what do you like the most about working here at Hrosm?
So for me, it's, or at least one of the things, is having the direct access to the doctors here in the building. If we have a question, if a patient has a question, or there's other concerns or things that, we want addressed, they are right down the hallway from us. And if that specific doctor isn't here that day, then someone from their team is, and we can usually get, questions answered or, what we need addressed that very same day. Before I came here, I worked in a hospital system for 12 years in this area, and actually I treated a lot of patients that came out of this office. But most of the time what we would get was just a one-page PT order that would have the diagnosis and again having shoulder pain or back pain, but we didn't get any detailed information for the most part. So being here, I have access to X-ray and MRI images and findings, any op reports if you've had surgery, and then as well as the doctor's notes themselves from when you come in as a new patient to be seen by them, and then any follow-up visits that you would have after that. So that's having been on the outside of here, and then now working on the inside, that's been a big positive difference for me, and I think that leads to improved quality of care and just getting things done in a more timely manner here at Hrosm.
Awesome. I mean, that's definitely true. It's in-house. I mean, it's very, I guess, comprehensive would be the right word, to see everybody at once. So awesome. This was short and sweet. Thank you so much, Dr. C, for your time today. I'm going to awkwardly turn my camera around. Thank you, everybody, for joining us. Like I said, this is our third week doing PT Talks. We have 2 more after this. Next week, we will be speaking with, is it Shannon? I think Shannon Jackson. She's one of our physical therapy assistants, so definitely tune in for that. And as always, if you have any questions, feel free to comment. You can message us here on Facebook or explore our website at www.hrosm.com, and you can request an appointment or try to search for answers to any questions that you might have. Before we go, I just want to remind everyone watching that next Thursday on the 21st of October, we will be having a Bones, Bites, and Brews event, and that is going to be at Tradition Brewing Company right down the road in City Center. It's totally free to attend, and if you would like to come, if you have questions about physical therapy or about orthopedics or sports injuries or what have you, definitely make sure to register. This is a free event. Members of our physical therapy staff will be there to answer questions, as well as a couple of our doctors. So definitely don't forget to register for that. And as always, thank you for joining us. We hope to see you next week, and I hope everybody has a wonderful weekend.